Hello everyone, I am Dr. Dilip Kumar. I am Director of Cath Lab at Medica Super Specialty Hospital, Kolkata. Today I will discuss about edema and pedal edema to be more precise, because it's a very common problem and people come with a lot of apprehensions, lot of anxiety when they see swelling in their ankle or their feet. So to begin with, what is edema and what is edema? In fact, this is accumulation of fluid or swelling in any part of the body. So if it is facial puffiness, facial edema. If it is abdominal swelling, it's abdominal edema. And then there is the commonest is pedal edema, because the lower limb, legs, are the most dependent part if we stand. Okay. So if the intravascular volume is high, if the proteinuria is happening and in body there is less protein, albumin is there, so the retaining capacity of the intravascular volume is less. So the the excess accumulated fluid goes into dependent part, and that's why pedal edema is the commonest. Now coming to the reasons of edema, why edema happens. So edema can happen because of many reasons. First and foremost is because of the less protein in the body. It can be because of malnutrition. It can be many other reasons, because leak from protein from the urine, one of the very common reason, what we call nephrotic syndrome. And then comes with the liver problems. So in cirrhosis of the liver, we get fluid accumulation because protein in the body is very less. And there is also hypertension, what is called portal hypertension. So there is a lower limb edema and abdominal fluid accumulation, what is called ascites. Beyond these two reasons, one of the biggest reason is cardiac problem. So if your heart is failing, then the backward accumulation of fluid happens. So it starts from the lungs when the patient develops shortness of breath, then it goes down in the body. The patient gets this tender hepatomegaly, liver gets enlarged, there is swelling in the abdomen, and then finally swelling in the feet. And this is a classical sign of congestive heart failure. So if someone has developing swelling in the body, especially in the lower limbs, you should be alarmed of these reasons. So a kidney problem can happen, a liver problem can happen, and then heart problem can happen. Sometimes some of the patients were people who are very obese and very overweight. So once they stand up, the fluid tends to go down little, and then there also we can see kind of edema. And sometimes there is obstruction. If the venous obstruction is happening somewhere, like in what is venous obstruction? So veins take out the deoxygenated blood from the body, and they through different veins it goes into IVC or an CVC, it goes to RA and then right ventricle and pulmonary circuit. So anyway obstruction happens, then there will be a backflow, and the back pressure changes, and the pedal edema can happen. Anywhere the swelling can happen. If there is a problem in the subclavian vein, in the or SVC, then the facial puffiness can happen. So the obstruction is also a very important reason, and this obstruction can be because of the thrombus, or can be because of the lymph nodes. If there are some lymph nodes are there, there's a tumor is there, so these can also lead to edema and fluid accumulation because of back changes. So I discussed about the reasons, and sometimes infection like cellulitis. If the lower limb cellulitis, you can see a large swelling and which will be red inflamed. So how to differentiate? So if someone has a unilateral swelling in the leg, it means it is a local problem, there is an obstruction or an infection. If there is both limbs are involved, then there could be a systemic back pressure changes like cirrhosis, nephrotic syndrome, a heart problem which I discussed, and finally malnutrition, hypotonemia. So this way we differentiate. But at the same time, I must tell you, once you get on the reason, majority of the time, we can treat you. Like heart failure is happening, we can treat you with wonderful drugs which are there in our armamentarium of treating heart failure. And if there is cirrhosis, the nephrotic syndrome, we can look into reasons and we can treat it. So be aware of edema, any swelling in the body, any fluid accumulation. Get alarmed, seek medical attention as early as possible, and get yourself treated. Thank you so much.